Okay, I've started recording. So I'm going to mute again, and once it's sharing, you can just fire away. So I'm just going to share in a sec.
Hello. The London Diabetes Centre at London Medical is delighted to acknowledge World Diabetes Day this year. Now, the 14th of November was chosen several years ago to represent diabetes to the world. And the reason was, if we could have the next slide, please, that one of these two gentlemen, the man on the right, Frederick Banting, it's his birthday. Well, was his birthday on the 14th of November. The man on the left of your picture, the younger looking man, is Charles Best. Now, Frederick Banting was a very eminent surgeon at that time in Toronto, Canada. And this picture is taken on the roof of their laboratory in Toronto. And Charles Best was a medical student at that time, working with Frederick Banting. And they were working on the isolation of a pancreas chemical, which was called at that time insulin, had been called insulin. And they were working mostly on, as you can see, dogs. And this is one of their dogs, sometimes called Marjorie, but that's not absolutely sure that that's the right, her right name, but it's certainly dog 408. You can see they did a lot of experiments on dogs where they actually removed the pancreas from the dog and then chemically extracted the contents of the pancreas and made a relatively pure, although by modern day standards actually quite an impure, mixture of insulin. Now, this work had followed on from many years of people doing experiments. Started off, in actual fact, in the 1860s by a very famous German physician called Paul Langerhans. And he actually identified that there were clumps of cells in the pancreas, which then became known as islets of Langerhans, where insulin was produced. Lots of people worked on it, but some other famous people was again a German physician called Minkowski, and he did a lot of work at the end of the 1800s. And then obviously things started to be affected by the First World War, and the baton was picked up again after the First World War in the late 1918, 1919 and 1920s. And this is when Frederick Banting, Charles Best, Dr. Collip and John McLeod came together as a group in Toronto and produced the chemical insulin. And a few months later, in January 2022, the 11th of January 2022, next slide, they were confident enough to give this to their first human. And this is a man whose picture up on the top left there is called Leonard Thompson, and he was a 14-year-old boy. We don't actually have a picture of what Leonard was like at the time of receiving this first injection of insulin, but it was very similar to the pictures that you can see in the top right-hand panel. At that time, essentially, developing diabetes as a young person was a death sentence. And dramatically, the child, like the one in that picture, went after a few days, not many more than weeks, to the picture that you get on the top right-hand panel. Miraculous. And people did actually think of it as the miracle of insulin. You can see another famous person, the young girl, Elizabeth Gossett. Elizabeth Hughes at that time became Elizabeth Gossett, who was actually wife of the Secretary General of the United States, the daughter of the Secretary General of the United States. And they actually asked if Banting would give their 14-year-old daughter insulin, which because she developed diabetes and was doing very poorly at that stage. And again, she did. And she lived for up until her 70s after this miraculous cure of insulin. You can see it caused quite a fuss. The Toronto Daily Star, famous headline, Toronto doctors on the track of diabetes cure, and they were. And what happened then was quite interesting, not just in the medical world, but in the social world, is that was one of the fastest ever stocks and share rises in world history. Two famous companies came out of this initial finding, Eli Lilly in America and subsequently Novo Nordisk in Denmark in Europe. And suddenly the whole world of diabetes was transformed, turned on its head with the introduction of insulin injections. Next slide. So a lot of work then went on from the 1920s, really right up until the 1980s. Now, although there was tremendous biochemical, physiological work done on insulin, and this is a wonderful picture of one of Langerhans's islets showing the insulin productive cells in blue in the middle of the islet. The actual use of insulin didn't change a great deal. It was given by injections subcutaneously. There was a lot of work done in adding to the properties of insulin, adding different chemicals, adding different proteins, and this basically altered the absorption of the insulin from the skin and into the body. And this was something that made big changes in terms of the management, but was essentially based on giving 1, 2, 3, 4 injections a day of the insulin. As I say, the biochemists and subsequently the molecular biologists did wonderful things. Insulin was the first full protein to have its amino acid sequence by Frederick Sanger. And a very famous thing that came out of insulin, it was the first protein to be linked to what's known as a radioimmunoassay by Rosalind Yallo. And these two people, Sanger and Yallo, together with Banting, Best, Collip and MacLeod, all received the Nobel Prize for their work on insulin. So next slide, please. There was, though, a big turn in the 1980s and has continued on upwards. So you can see we went from giving basically insulin, using initially up until the late 70s and early 80s glass syringes, and everybody with diabetes had to look after the glass syringe, keep it as clean as possible. The insulin was produced, it got purer and purer, and as I say, its properties were slightly changed. But then in the 1980s, things really started to move on. First of all, disposable syringes became the commonplace, and then they were soon replaced by insulin pens, which are still in operation today. And the different types of insulins expanded and were utilized in all sorts of different ways to help people manage their diabetes. And subsequently, in the last 10 years, there's been a massive explosion in terms of technology helping deliver insulin in the form of insulin pumps, and there are now an expanding number of pumps coming on to the market, some of which are what's called tethered pumps, where they rely on the pump pumping a small amount of insulin constantly through a small plastic tube, which is then inserted through into the skin through a needle, or what's known as patch pumps. There's an example there in the photograph where they're just placed onto the skin, stuck onto the skin. And people learn to use the pumps, choose which one they like, and form their own views on the different pumps. Coupled with what's known as glucose sensors, this has been a massive change. It started in the 1980s with finger prick blood glucose testing. Prior to that, you had to manage your diabetes by measuring the glucose in the urine. But in the 1980s, the ability to measure small amounts of blood, very small amounts of blood, from a finger prick and measure your blood glucose came about. But now we've got the exciting world of glucose sensors, where these are placed into the skin, stuck onto the skin, and these will give you a constant readout of blood glucose there and then. So next slide, please. So it's been an exciting journey over the last nearly 100 years. So next year will be 100 years since the first, next January, in fact, not far from now, will be 100 years since the first injection of insulin into a human. Trying to mimic, trying to replace what the pancreas does automatically for people without diabetes. It's not easy to do that, and all sorts of tricks and ideas and thoughts have been put forward over the years to try and make this as efficient as possible and as effective as possible. But we're now at, I think, an even more exciting era in diabetes, with the possibility of a whole pile of group of new inventions, new innovations, which will help the person with diabetes. The artificial pancreas, efficient sensors, connected pens, smart insulin, immunotherapy, transplants. So the next slide really just tells us what London Medical, London Diabetes Centre, can offer. The artificial pancreas is here. What is that? Well, this is linking the blood glucose sensors, the continuous glucose monitors, which are placed into the skin and now last up to 14 days. And you don't need to change it for 14 days, and you don't need to do blood glucose tests to monitor the sensor. You just place it in and it gives you a reading virtually straight away, and a regular blood glucose reading. What's been exciting in the last year, last 18 months, is that using algorithms which are placed on either a mobile phone device or a specific device given by the pump manufacturers, it links it automatically to an insulin pump, and the insulin pump therefore then delivers the amount of insulin that they estimate that the body needs in relation to the blood glucose. Now, it's not completely automated. It's sometimes a little bit difficult to get around managing food, but with a little bit of knowledge about what you're eating in relation to the carbohydrate content, you can really smooth out the blood glucose levels throughout the day, and the artificial pancreas is doing all the thinking for you. These are here. These are available, and we're using them on young people, middle-aged people, elderly people in the London Diabetes Centre. Efficient sensors are really been brought in the last 6 to 9 months. As I say, they're now lasting up to 2 weeks. Very little care needs to be given to the sensor. They're placed in and they work constantly during that time, and there's going to be more of them. Different companies are looking into them, and I think they'll become even better, even more efficient and effective. Next in to come are connected pens. Now, these are not quite here at the moment. We're very interested in them in London Diabetes Centre. These are essentially pens connected to a glucose sensor. So if people can't quite manage with the pump, and it's not for everybody, then maybe connected pens will be the way to go. There's been lots of trials on these, and I'm pretty confident that these will be available in the next year. And certainly one of our jobs at London Diabetes Centre is to look out for these and take them forward when they're available. Smart insulins, what do I mean by smart insulins? Well, these are insulins which themselves have been altered, and as I said to you before, there's a long history of altering insulin, so this is not new, but altered in a completely different way, in that they will release themselves in relation to the amount of blood glucose levels in the body. Whether this will be very useful for somebody with type 1 diabetes as such yet, we're not so sure, and that will be something that will need to be watched very, very carefully. But what we certainly do now have is very highly refined insulins, very long-acting insulins, as well as very rapid, fast-acting insulins, which we use regularly at London Diabetes Centre. And then finally, the world of immunotherapy and transplants. This has been around for a long time. It's got some moderate success, but transplants are essentially those of islet cell transplants and not pieces of pancreas. So they have to prepare the little islets from the pancreas in a chemical way, and are not really being given to people other than those who've got real difficulties with their diabetes at the present time. Couple this with immunotherapy, such as stem cell transplant or even islet cell transplant. And again, these are being worked at in various parts of the world, lots of research going on to that. And there may well be in the next 18 months a significant change in some of the immunotherapy approach to diabetes using substances called monoclonal antibodies. And certainly London Medical is very interested in this area, which could make life really quite more easier for people with diabetes, certainly in the first few years, 4 to 5 years. And this obviously would be something that would be very helpful for young children and their families. So next slide, please. It's been an exciting journey, really, since 1921, when Banting and Best and other colleagues produced insulin, acknowledged in World Diabetes Day. It's become a very exciting arena in the last 5 to 10 years, and I think that excitement was going to continue, and it's very much London Diabetes Centre objective to be up with that, to follow the new trends, to follow the new ideas, and offer that to patients as soon as possible when it's available. So with you, I will very much salute World Diabetes Day, and I wish all our children, teenagers, young adults with diabetes and their families best for the future. Thank you.